Hello, my name is Dr. Gayathri Perera and I'm a consultant dermatologist. I have an NHS practice at the West Middlesex University Hospital and a private practice at the Medical Chambers in Kensington. One of my interests is psoriasis, which is a chronic skin disease, and this is something I'd like to talk to you about today. So psoriasis affects 2 to 3% of the world population, so it's quite a common disease. It can affect the skin and it can affect the joints, or it can do both. Psoriasis can present in many different ways, and although the word psoriasis seems to encompass a whole variety of different ways that patients can manifest the disease, we have the same kind of treatments for different types of psoriasis. So you can have psoriasis that just affects the scalp, just affects the nails, or both, or various parts of the body. The most common ones being the elbows and the knees. They are large pink patches with scaly bits to them. Sometimes this has no impact on someone, and sometimes it can be devastating because you may find that people avoid you, they don't know whether it's catching, and even in this day and age where people really do know about skin diseases, you find that you're stigmatized. So it has a huge social impact. And we know that psoriasis has a very high rate of depression. But once you treat the psoriasis, your depression and anxiety gets so much better. So this is a really good reason to consult your GP as soon as you are worried or think that you may have psoriasis, so that you can get a specialist opinion from a dermatologist, be it on the NHS or privately. So with psoriasis, the problem is that your skin is turning over 36 times faster than someone who doesn't have psoriasis, which basically means the top layer of your skin gets accumulated and into a thick area. And this is as a result of many different combinations of factors, including the genetics, your immunology, your body's ability to fight itself, and in a way it's fighting something it doesn't know about, and also environmental issues. So all these things make up a very complex disease. Now, the treatment for psoriasis has come on leaps and bounds over the last 10 years. So whereas originally it was to do with coal tar baths, being admitted to hospital, very rarely is anyone ever admitted to hospital. You have topical treatments that, if they're too messy or they don't work, then we accelerate your treatment to maybe, if appropriate, give you light treatment. And that can be 3 times a week for about 8 weeks, and sometimes this gives you the best possible remission from your psoriasis. For those people who don't respond to light or for topical treatments, then we can give you other tablets. Now, some of these tablets have side effects, but the whole idea with seeing a specialist is so that you can talk about the side effects. You can talk about what suits you, whether you really want to do this or you don't. And I think it's very important that you're not scared of getting that diagnosis thinking this is the end, there's nothing else that can be done. If tablets don't work, then there are these new drugs called biologic treatments. Now, over the last 8 years, a lot of the ones that are approved here have been approved in America and in Europe. They are prescribed only by dermatologists or rheumatologists, depending on your joint situation, and they are in the form of injecting drugs into yourself. Now, most of them you are self-administered at home, so that makes it far more convenient. It's not every day, it's either once a week or once every 2 weeks or once every 3 months. So for those people who don't respond to any of the other treatments, then there are these drugs. Now, the most important thing is if you're at all worried that you have psoriasis or feeling anxious about any of the conditions that we've talked about, then go to see your GP and seek specialist advice.